Okay, let's get started. So in the last lecture, I laid out these basic principles that we're going to be focused on for the rest of this course. And we're talking about problems for the control of organ systems, and also some of these issues span organ systems. And so we laid out these basic parts for control. And so continuing along this theme of just sort of laying out the basics for part 3 of the course, this lecture is focused on the efferent side of things. Okay, so of course, for control systems, that is negative feedback control systems, you have a sensory component. The sensory information is gathered up, and decisions are made according to algorithms, so that efferent pathways become recruited in response to this stimulus. So let's focus on the efferent pathway, because by laying it out in this abstract way, we've considered cars, and we just started to lay out some of the specifics for thermoregulation. It's rather abstract, so let's talk a little bit more concretely and lay out the different kinds of efferent pathways that are recruited by your central nervous system. Now, I'll say, these control systems, we've already seen, at least for positive feedback, how you can have a control system that is all within a voltage-gated channel. So a transmembrane protein is capable of having sensory parts, decision-making parts, and efferent parts all by itself. But when we're talking about the control of an organ system or spanning organ systems, then really parts of the brain are going to be recruited. The central nervous system gets involved. The integration centers tend to recruit the central nervous system, and they gather up sensory information from the periphery. And so what I want to lay out in terms of specific examples of efferent pathways have to do with the kind that control organ systems. And so the two questions for this lecture are, what are those efferent pathways used by the central nervous system? So the efferent pathways are actually in the periphery, but they're recruited by the integration centers that are in the CNS. Okay, so CNS means central nervous system. And under what circumstances are each of these pathways used? Because the different kinds of responses are recruited under different circumstances. They have different functions. So we're going to talk about that. Okay, so we already started on this subject when we were stepping through the control system for thermoregulation. So we had two parallel efferent pathways. The first had to do with shivering. And so you have somatic motor neurons that recruit skeletal muscles, and those skeletal muscles shiver. They generate contractions, they're inefficient, and as a consequence, that generates heat. And one distinguishing feature of different kinds of efferent pathways are the neurotransmitters that are involved. And we already know how acetylcholine is released onto the motor M plate to activate a skeletal muscle. That's old news. And the cell body for that motor neuron is based in the gray matter of the spinal cord, and it emerges from the ventral, the sort of belly-facing side of the spinal cord, to activate those skeletal muscles. Okay, so that illustrates an example, and it's one kind of efferent pathway. Could you please close your laptop? Sir? Could you close your laptop, please? Thanks. Other kinds of efferent pathways are illustrated by this example here. And so I just squeezed this in at the last second, but it's that example of smooth muscles around cutaneous blood vessels. All right, so what was this? This was a case where you've got a low temperature stimulus, right? That makes sense, it's cold, so you shiver. And then the cutaneous blood vessels undergo vasoconstriction, so blood flows into the interior of the body away from your skin. All right, so the way that looks in terms of the pathway is we have a smooth muscle. That's the efferent organ. That's the target of the activation. The neurotransmitter is known as norepinephrine. Okay, so the norepinephrine activates those smooth muscles. And this is known as an autonomic pathway. So you're conscious of smooth muscles, skeletal muscles that are activated by somatic neurons, motor neurons. You're not conscious of smooth muscle activation. Maybe secondarily, I mean, you can feel rumblings of your stomach, but that's like a secondary way that you become conscious of it. So this particular autonomic pathway, we've got the norepinephrine release. Also, there's a chemical synapse along the way, and that features acetylcholine. And that's placed at something called the autonomic ganglion, which is also on the dorsal side, just like that motor neuron. But because we've got this synapse there with a cell body, then there's this thickening of the nerve, okay? And so wherever you have a whole bunch of cell bodies, you call that a ganglion. So it's similar to the motor neuron in that there was a cell body in the gray matter. It's just that along the way, there's a little chemical synapse. That's not really a big deal, to be honest with you. I mean, it's essentially faithfully transmitting that signal. Wherever you have a chemical synapse, there's always the potential for integration. There's decision making that could be made at that ganglion. But in most of our physiological examples, it's just transmitting the signal. All right, so those are two examples. And now what I'm going to do is lay out those where they fall relative to alternative efferent pathways. Okay, so when I'm done with this slide, you'll have a global view of all possibilities for efferent pathways that are used by the CNS. All right, so somatic. We got the motor neurons, acetylcholine, skeletal muscles. Now, the nicotinic receptors that we already know about are a member of a class of cholinergic receptors. So that's because they are receiving acetylcholine. So that's another distinguishing feature of this particular kind of pathway. All right, now this is because we're talking about skeletal muscle, and skeletal muscles are attached to your skeleton. Then that generally means that there's motion or isometric contraction, the generation of force. And so somatic motor pathways are recruited when there are behavioral responses to a stimulus. Okay, if you think about it, skeletal muscles are the tissue type that is used for behavior. Behavior, if you just define behavior broadly as movement of the body, I know there are lots of levels that you can apply to the definition of behavior, but for our purposes, it's very mechanistic. It's just if you have motion, then that's a behavior. And so that's going to require the recruitment of this kind of efferent pathway. All right, and of course, we call the skeletal muscle, in this case, the effector organ. And so we can contrast that effector organ with the alternatives. So we just talked about, for thermoregulation, smooth muscle. So this big slab of red here is sort of generically for all of this stuff that's shown down here. Smooth muscle, cardiac muscle, glands, and adipose tissue. Okay, adipose tissue is fat tissue. It's where fat is stored in the body. So there. All right, so for all of those kinds of efferent organs, they are recruited by autonomic pathways. You are not conscious of them because skeletal muscles are not involved. So the first flavor of autonomic pathway is known as a sympathetic autonomic pathway. All right, so we just saw an example of that, and we know that it's a sympathetic autonomic pathway because of the neurotransmitter. And if we wanted to look carefully at the receptors for the neurotransmitters, those would also be distinguishing properties. So just like we saw for those cutaneous blood vessels, we had acetylcholine along the way, there's a ganglion right there, and then eventually we've got norepinephrine released at the effector organ. Okay, so NE here is for norepinephrine. All right, now there are different types of receptors, and the only reason why I want to introduce these is that they have different functional properties that are important. All right, so the two types of neurotransmitters that we're going to consider for these autonomic pathways are norepinephrine and epinephrine. And both of those are, you can think of as sort of adrenaline. And so this class of receptors are called adrenergic receptors. Okay, so an adrenergic receptor is sensitive to norepinephrine or epinephrine. Now, for a sympathetic pathway, both alpha and beta 1 receptors are possible receptors that could respond to norepinephrine release by this autonomic pathway. The autonomic sympathetic pathway. Okay, so that completes the possibilities for a sympathetic pathway. If you see all those parts, and if you see it either an alpha or beta 1 receptor, then we're talking about a sympathetic pathway. Yeah.
So norepinephrine and norepinephrine have to be released first, and then the alpha and beta 1 receptors activate?
So at a chemical synapse along a sympathetic pathway, the receptor can have either an alpha or a beta 1. I guess theoretically possible that you could have both, but you don't need to have both.
But like they activate in response to norepinephrine release, right?
In order to have a smooth muscle respond to the release of norepinephrine, as far as we're concerned, it has to have alpha or beta 1 receptors. Okay, but there's another kind of sympathetic pathway, which we call the adrenal sympathetic pathway. Now, the adrenal sympathetic pathway includes the adrenal medulla, which is a gland that sits atop the kidney, seemingly having nothing to do with the kidney, although kidneys, as we know, get a lot of blood flow. And so if you want to insert a hormone that gets sent through the body very quickly, that's not a bad location. And so what the adrenal medulla does is it releases epinephrine into the bloodstream. And any organ in the body that is sensitive to the release of epinephrine can be activated by that release. So the adrenal medulla is functioning like a radio transmitter for the body. And any cells that have a radio that can tune to that frequency that's being transmitted can respond. And the way that they're tuning their radios is whether or not those cells have beta 1 or beta 2 receptors. So the sympathetic pathway is for very targeted responses, individual smooth muscles, individual glands, individual adipose tissue that is activated by the autonomic nervous system and has either alpha or beta 1s. That's a targeted response. And we'll see that when we talk about, say, the autorhythmic cells in the pacemaker of the heart, they respond to norepinephrine that is released by neurons that terminate at the heart. Whereas if you just want the whole body to initiate some response, then that is orchestrated by the release of epinephrine by the adrenal medulla. Okay, so the other question that we had was, what are the function of these pathways? Okay, so we know that somatic pathways are activated for behavioral responses, whereas this first pair of autonomic responses are activated under active or stressful conditions. Okay, so when you're running from a bear, this is the fight or flight response pathways. When you're running from a bear, then these are the ones that are going to be activated. All right, and so what this shows is that by having two possibilities, you can have a localized activation by transmission of norepinephrine via a neuron right at the site of the cells you want to activate, or you can have a systemic response through the release of epinephrine. And by having different kinds of receptors, you might sort of at first wonder, like, why would you have 3 receptors when you've got 2 pathways? But there's actually a value in that. Essentially, the alphas are dedicated receptors for the sympathetic pathway. They are only responsive to norepinephrine. And the beta 2s are dedicated to the adrenal sympathetic pathways. They only respond to epinephrine release. So what the beta 1 provides is like a hybrid receptor. It can respond to either one. So you could have that at the chemical synapse of a sympathetic neuron, so it gets that targeted control. But then it's also activated by this release of norepinephrine in the bloodstream. The beta 1s are slightly less, since they're sort of a generalist receptor, they're slightly less sensitive to either one, either norepinephrine or epinephrine, but they have that ability to respond to both. Okay, so the last autonomic pathway that we're going to talk about is called the parasympathetic pathway. And it also features a ganglion, and that ganglion also features acetylcholine. So we can see there's acetylcholine in the somatic pathway, acetylcholine in this ganglion, acetylcholine in that ganglion. If you had to guess a neurotransmitter, acetylcholine would be a good guess. And then it turns out the parasympathetic also releases acetylcholine right at the end of this pathway. Okay, now the positioning of the ganglion for the sympathetic pathway tends to be a little different from the parasympathetic pathway. We'll show examples of where they are positioned in a bit. But the same basic parts are similar. It's just that if you wanted to differentiate parasympathetic from sympathetic, one way would be the neurotransmitter at the end. You've got norepinephrine for sympathetic, you've got acetylcholine for parasympathetic. What is the function of parasympathetic? Well, we have 2 pathways for when you're really freaked out about something. Those are the sympathetic pathways. These are the opposite. These are the relaxation pathways, or the ones that tend to be activated, like right now. If I don't yell too much, then your sympathetic nervous system is probably far more active than your sympathetic pathway, unless you have like a test coming up or you're stressed out about something. The parasympathetic autonomic pathways upregulate routine maintenance, okay? Digestion, fat production, urination, okay? The production of feces. These are things your body should not be focused on when chased by a bear. But they are perfectly normal physiological responses when you can be relaxed. Okay, so what we're going to do now is give specific examples of these pathways. Okay, we've laid out what are the possibilities, and let's just let's see where they are in your body. So first of all, the control of digestion. Now, there are a lot of local decisions. The enteric nervous system makes a lot of local decisions about how it's processing your meal, depending on how fatty it is, how acidic it is. We've talked a little bit about that. But again, there are situations where your body wants to decide whether or not to prioritize digestion. Like, is this a good time to have vasodilation of the blood flowing to the viscera? Or instead, should we shunt that blood away to the skeletal muscles because we're being chased or something like that? Okay, so here we have a parasympathetic pathway. So I'm going to show parasympathetic pathways in red. There's a ganglion for that pathway, and in general, the parasympathetic pathways, their ganglia are positioned relatively close to the efferent organ, as opposed to the sympathetic one where the ganglion's right next to the spinal cord. So if you're relaxed and your body wants you to focus on digestion, then it will activate these parasympathetic pathways via a descending command for digestion. It turns out to be in the hypothalamus. And that's going to activate blood vasodilation, blood flow. It might enhance motility in the viscera so that there's more churning, your stomach growling. These things tend to happen when you're relaxed. And so we can be specific about that. We have an increase in motility. Your pancreas, you'll recall, is involved in buffering the acidic kind that comes out of your stomach. There are digestive enzymes that are released by the pancreas, so that is also a target of parasympathetic pathways. Now, we're not yet going to talk about insulin secretion, but insulin plays a role in the storage of glucose by the body and the conversion of glucose into fat storage. That also is upregulated via parasympathetic pathways. And so, so that also happens, again, we'll get into the details later, but that also happens in the pancreas. So the pancreas not just secretes stuff, but also plays a role in the energy balance of the body. All right, it's only when you're relaxed that you can really urinate, and that's because parasympathetic pathways are involved in that process as well. And we're going to talk about the micturition reflex, which is what governs urination in a little bit. Okay, another example of parasympathetic activation is in the bronchioles. Okay, so there tends to be a reduction in bronchial diameter that creates more resistance to airflow. Your heart rate tends to be depressed. Okay, so that's through parasympathetic pathways to the autorhythmic cells in the heart. The sex organs are mediated by parasympathetic pathways. They're responsible for erection. So that also requires. So these are efferent pathways that are often at odds with sympathetic pathways, and so it's hard to get an erection if sympathetic pathways or like epinephrine is released in the bloodstream. Okay, so how about those sympathetic pathways? So let's take these same target organs and just consider how the sympathetic pathways compare in their responses and also the positioning of those neurons. So again, the autonomic ganglion is close to the spinal cord. It's not it's not positioned right near the efferent organs. So we'll show these pathways in green. So whereas we had an increase in gut motility in response to parasympathetic pathways, you just see the reverse for the sympathetic pathway. And that's quite often the case. You just see one for parasympathetic, or one direction for parasympathetic, you just see the opposite direction for sympathetic. Now, as this table gets really big, don't feel like you need to keep pace because you're not going to have to go home and memorize all the directions of these arrows. And I'll explain what you need to know in a minute. So don't worry if you're not keeping up. Okay, whereas for parasympathetic, you have an increase in insulin secretion, which stimulates the storage of energy. Sympathetic pathways cause a reduction in insulin secretion, and they're also involved in the release of energy stores. Again, being chased by a bear, you want a lot of glucose in your bloodstream so that the skeletal muscles can produce ATP. Sympathetic pathways are responsible for fat breakdown, and so they tend to be recruited if energy stores are low when you're exercising. They inhibit the micturition reflex that's responsible for urination. So again, being chased by a bear, you're not really too worried about whether you have to urinate. There's an elevation in beat frequency and in stroke volume. The arterioles depends on where they are located, the arterioles in the lungs. So sympathetic inputs can either, depending on their positioning, cause an increase or a decrease in diameter. But in general, the goal is to keep your breathing passageways open, and that indeed does happen in response to sympathetic pathways. You also tend to sweat, and that is also activated. But if you have panic attacks, those are being mediated by sympathetic pathways, and so sweating is a common effect of a panic attack. Okay, they also play a role in sex drive, and so yeah, so sex is weird, and And so parasympathetic pathways are required for erection, but then sympathetic pathways are recruited for ejaculation. So yeah, strange mix. Okay, so sympathetic pathways, we have not just the neurons that terminate and release norepinephrine, but we have the adrenal sympathetic. And so these sympathetic pathways that are shown in green can be differentiated in their responses according to what types of receptors are on the target organ. So if you see, again, alpha receptors, that means they can only respond to norepinephrine. Beta 1s means they can respond to both norepinephrine and epinephrine, and beta 2s are dedicated to epinephrine. And so you can go down the list and just monitor the receptors and decode whether or not they can be sensitive to or included in the sympathetic or the adrenal sympathetic or both. And so in this case, in the GI tract, there are smooth muscles and arterioles that have both alphas or beta 2s, meaning that they could respond to, if you have an organ that has both, they can respond to both of those neurotransmitters. And you can just go down the list here, okay? So the pancreas, in its function for releasing enzyme secretion, we've got alpha receptors on that, which means norepinephrine is going to mediate that. Fat tissue has beta 1s and beta 2s, okay? So it's not as sensitive to norepinephrine, but it's possible to respond to norepinephrine because of this presence of the beta 1s. Urinary bladder has the alpha and the beta 2s, developing an accent. And so you can go down the list. Again, you don't need to memorize this. And so what you might at this point be asking, what do I need to know? And I would say just be familiar with these functions. You want to know what are the functions that you ought to be recruiting when you're being chased by a bear, the sympathetic pathways, versus the ones that are important when you're relaxed and you can focus on routine maintenance. And you should also be able to interpret the meaning of these receptors, that is, how they differ in their response to norepinephrine or epinephrine. So to give you an example of that, we have a clicker question. Okay, smooth muscles in the GI tract have beta 2s, but not beta 1s or alpha receptors. Which of the following affect digestion? A, acetylcholine, B, norepinephrine, C, epinephrine, D is all the above, or E is B and C. Okay, give me your final answer. Okay, so the majority of you were paying attention. The correct answer is epinephrine. Okay, so of course, the efferent pathways are just what your body does in response to something. It's just a piece of a control system. And for regulatory functions, we're talking about negative feedback control systems. Where are the decision-making centers for these pathways? Well, it depends on which ones, but for which pathways. But the autonomic nervous system has they will recruit autonomic neurons, that is the interneurons that descend down to a region of the spinal cord, the cell bodies for those interneurons will emerge through these brain centers. And the one that we might talk about the most is the hypothalamus, which is just anterior to the brain stem. The brain stem includes the pons and the medulla oblongata. All right, so these are not just where the cell bodies are, but they're also sites of integration as well. And so for these regulatory functions. So we'll see these parts of the brain appear a lot in regulatory physiology. And you'll notice in my explanations of how they make decisions and how they receive commands from the periphery, that my explanations get a little fuzzy because our understanding is a little fuzzy. So here we see an fMRI, which is a way of monitoring blood flow in certain regions of the brain, which is correlated with their metabolism, which is correlated with how active those cells are. And you see this a lot in popular announcements about scientific results, because fMRI is very powerful in its ability to visualize the active regions of the brain. But it's also not terribly mechanistic. It only tells you the regions that are active. And that approach is providing a lot of insight these days, and it's better than the traditional approach of somebody gets an accident and their brain damage, and then people notice deficits of some sort, which is a sort of radical experimental manipulation. But in both cases, we're not really, because of the complexities of the brain, we don't really provide satisfying explanations of a series of synapses or a network of neurons that give you this emergent behavior. We understand what emerges from these black boxes, these regions of the brain, but you'll see as I'm explaining what the brain does, I will just sort of refer to the complexities of the network and might be able to point to some region of the brain that is active. All right, so in response to this question that we laid out at the beginning about what are the efferent pathways, we see the somatic pathway, and then we have two varieties of autonomic pathways, the sympathetic, the adrenal sympathetic, and the parasympathetic, and that they are used under different circumstances, be it behavior or excited physiological responses via the sympathetic pathways, or rather maintenance functions for the parasympathetic pathways. All right, so I'm going to start on the next set of slides. Just give me a second to set that up.